Okay, so we've got a corn in a really common location here. So this is the plantar fifth metatarsal head. So obviously the patient walks in and says, this is a painful lesion. They don't remember doing anything to it. And we've done this one actually before, so we know what we're dealing with here. So we just go and remove the callus cap as per usual. And just have a look what's in there, make sure there's no ulceration or anything. And you can see there's a little corny center or a really concentrated section of hard skin there that we need to remove. So we'll go ahead, we remove all the surrounding tissue. Now we know that this one, if we take too much off, this one gets painful, so we can't remove all of the tissue. So the whole thing we're trying to do here is just make this more comfortable for the patient. So we've got to listen to what we've been told from the last treatment, and then if we take too much off, it hurts too much for too long. So this patient's happy to come and get it treated more regularly and just be comfortable and get it done every sort of 4 to 6 weeks. So basically we use the alcohol there to see through the skin and just see what's there, and then we go ahead with the tip of the 15 blade here and just remove that. Now that's a Swan Morton single use number 15 blade. We use this one for finer work. The number 10 is the bigger, fatter blade that we use for a larger, sort of more diffuse area of callus. It's still got the same cutting tip, but this one, we like using this one just because it's more efficient on these small locations. That's the only reason we use a different size blade, is just it's more efficient. You just use whatever you're actually comfortable with. Podiatrists from the UK usually use a 10A blade, which is a lot more pointed, more like a knife, but this one's more got a rounded cutting area. So we go ahead and remove all that and really try and just level out those edges or bevel those edges down so it's not a vertical drop right down into the corn, and we'll have a look and see how we went with that. And that should be a lot more comfortable. We've left probably about 10% of the callus there.